In double eyelid surgery, the muscle in the upper eyelid is functioning well. You can open and close your eyes normally. In ptosis surgery, that is when there is actually a problem with the muscle. The muscle is not anchored properly in the upper eyelid, therefore the opening of the upper eyelid is affected. And there are many different reasons or causes for that. One is congenital, you are born like that. The commonest would be congenital or senile ptosis. Senile, as you get much older, everything loosens and it stretches. In ptosis surgery, you actually need to open up the eyelid, look for the muscle, and reposition the muscle. And whether it's just tightening the muscle or actually cutting off a strip and then repositioning that to the appropriate height so that the eye can open properly. And it is actually a medical condition. It is not a cosmetic procedure. In the treatment of ptosis, there are again two ways: non-incisional versus incisional. In non-incisional, we're talking about really very mild ptosis, and it requires not trimming or cutting the muscle, but actually tightening the muscle with a suture, and it may not be permanent. With incisional, where we open it up, that operation is permanent. We will need to identify the muscle, dissect it out, reposition it and anchor it down, and then open the eye on the table before we close both eyes and see how symmetrical it is and whether the height is adequate. Muscle is very unique in the sense that because it's a stretchable material, tightening the muscle on one side may not be equal to tightening the same amount on the other side. That is why when we do the operation, we need the patient to be awake enough to open and close the eye so that we can judge. Because sometimes, even though the tightening may be equal, the actual movement may not be the same. The patient is awake and able to move the eye but will not feel any pain, because at the initial part of the operation, the patient will be comfortable, sedated, the local anesthesia will be given, and then the dissection, the incision is all done. Once everything is open and the sedation wears off, the local is already in, you don't feel any pain, you can feel the movement and the manipulation, and the patient will be able to open and close and respond but will not feel any pain. The procedure, ptosis correction, can take as short as 30 minutes or as long as 2.5 hours. It really depends on the difficulty in dissecting out the muscle and securing it. Yes, we have seen children for ptosis correction. In those cases, it's congenital ptosis. That means they were born with ptosis and the muscle is dehisced, is not attached to the eyelid margin. In those cases, we need to find the muscle, bring it down, release it if necessary, if it's a bit taut, if it's a bit tight, and then secure it to the lid margin so that it can open the eye. In our practice, ptosis is fairly common, and I would not be far off to say that we do almost a case a week. We have a very large volume of patients coming for ptosis correction. Unlike double eyelid surgery, where it's very nice and predictable, ptosis surgery can be a little unpredictable because, as I previously said, muscle is not a hard object where if you're going to move it 3 millimeters, it moves 3 millimeters. With muscle, if you move it 3 millimeters, that's the compliance or the elasticity of the muscle. So 3 millimeters may end up being 2, or could possibly be even 4 because of the stretchability. That is why the downtime, the recovery can be as short as 10 days or as long as 6 months.